Hello everyone, welcome to Story Time with V, where I will tell you a story from my real life and my misery is probably going to entertain you. Isn't this what the internet is about? Entertaining people. There's a lot of you asking me about it in DMs and some of you asking me in the live chat. I decided to make just a video where I talk about it, explain to you how a surgeon went with his scalpel inside me. I got penetrated. What horrible. And I have like this big bandage on my back in order to show. But before we get to that story, I need to tell you what happened previously. You see, in the beginning, I wanted to go to the private sector because I had this thing on my back, which was very painful. And it required drainage. It required, some medical care. It took $30 to get a surgeon's appointment where, he looked at it, poked it a little bit. It's like, yeah, we're going to chop it off. And I was like, yay, chopping it off. And like, after deciding that, okay, we're going to go along with it, he sends me down at the hospital with this lady that was supposed to be a patient consultant, where they explain to you the procedure, they explain to you the costs, and, they schedule you, whatever. Turns out like the whole procedure would have been $1,500. And I'm like, whoa, this came out of the blue. It's like, it's not that I can't pay $1,500, but I don't have them in my pocket right now. Like, well, what do we do about it? Is that a payment plan? And she's like, nope. It's like, oh, well, maybe I can contact my mother. Maybe I can e-beg a little bit. Like, I'm sure I can handle it. And as I'm talking with the lady, and, we're discussing costs and whatnot, she tells me something really weird. I ask her, it's like, how are the prices being spread out? And she's like, a lot of it was for the general anesthetic. And it's like, well, wait a minute, like, what? You're just supposed to drain a little bit from my back. Like, why do I need to go under? Can't you do, like, local? Like, what the hell? That sounded weird to me. That's very bizarre. But I assume like they were doing it like that. That's what I was thinking, is to get people to spend one night in the hospital. And if they spend one night in the hospital, then they pay more. Hey, the private sector, right? But normally, like for small surgical interventions, something that is not very invasive, especially like something at the skin level, you do it with local. There is no need to keep the patient one day in the hospital. But anyway, right? I'm talking with this lady, we're doing this conversation, and all of a sudden I get a message from my fiance. And I look at the phone and she's like, abort, get out of there. And I'm like, what? I'm like, chotomate, I tell the lady. It's like, something urgent came up, I'll be right back. And you could see she didn't like that. She didn't like the fact I was about to leave. And it's like, oh no, you can't leave. And it's like, no, I'm leaving. So I go out, and my fiance tells me, do you know who your appointment is at? Like, who did you schedule with? And it's like, yeah, doctor, and I give the name. It's Dr. Death. And she shows me, like, literally, it was, like, the most dramatic moment in my life, She's like, it's Dr. Death. And she shows me, like, this news article from the mainstream media. I think it was, like, 2 months old. And it literally, like, had the picture of my doctor on it. And it said, like, Dr. Death, he has killed 2 patients in the last year. Like, once someone take the scalpel away from his hands. And I'm like, look, woman, you're over exaggerating over it, right? Like, I mean, come on, it's the press. They hype things up. It's like, and even then, like, look, I just want a very simple procedure done. It's not like I'm getting a liver transplant. It's not like I'm separating congenital twins here. It's like I just did a... And it's like, no, keep reading. And she scrolls it to me. Like, she doesn't even look, she scrolls it to me. And it's like, here, fine. And apparently, like, there was this guy which had... what did he have? Oh, yeah. He had hemorrhoids. He went to the operating table and he went out with the morgue. And I'm like, holy fuck, how do you... how do you botch something like that? It's like, oh. Apparently, I think from my medical experience. I think like maybe that patient had several other complications, and it wasn't recommended that he would be operated on. You know, like that's what I'm thinking. You know, because that's the only way you can have someone with a hemorrhoid and ends up living with the morgue. So yeah, you know, like I'm deciding, okay, well, I'm not going to go at this doctor anymore. And I'm like, well, what do I do now, though? Because, fun fact, the radiologist commission is taking place right now, meaning you can't schedule yourself for more imagery, right? Like anything that has to do with sound or like ultrasound or radiology, anything like that. It's very difficult because most of them are gone to this congress where they get to learn more about their trade and their art. So I'm like, well, you know, the more I postpone this, which technically is a medical emergency, the worse it will get. Like I was afraid it will go all the way up to the neck, and then I'll need a vascular surgeon in order to operate. I'm like, oh my god. But eventually, you know, she knows a guy that knows a guy. Because again, like we both went to the University of Medicine, right? Like we both know the doctors. And you know, this guy who works at the state tells me it's like, well, just have like a COVID test done, like show that you're not infected, and then I can see you. I mean, it's an emergency, right? And if you come on Sunday on Saturday when I'm on watch, then I'll take you in and we're going to see what's up, right? So I take the COVID test. Turns out I'm clean. My question was like, okay, but what if I take it and it turns out I'm not clean? Well, what if I have it? It's like, what then? Do I get to stay home and suffer? Like, what is the procedure for that? But anyway, right. So I take the test. Turns out I'm clean. I go to the hospital and I didn't expect him to actually say, okay, well, take your shirt off and we'll, you know, like he does the thing with. I'm like, oh god. I have not prepared for this. Like, I need mental preparation. Do you know what day it is today? Like, today is the day where I make This Week is Stupid. Like, I need this. I need this. But already, like, this massive corporeal manifestation of a nurse was already sitting in front of the doorway, you know. In order to make sure that I don't leave. But I did realize, it's like, oh, come on, if I botch this chance as well, like, when is the next time I'm going to get one, you know? So I, you know, assume the position, and he tells me not to scream, and I say, no, I'm a banshee, I scream. If I feel pain, I scream. And he tells, no, because the university professor is outside, and you're going to scare the other patients. Because there was like an open window, you know, going to the outside, and I was thinking, it's like, yeah, you know, I guess it would scare the other patients. Like, imagine you have to go to the hospital, and you hear like this guy screaming his lungs out. Especially from a place that's coming from downstairs. But you know, like I go into this conversation with him and I tell him, it's like, have you ever been under the scalpel, doctor? And he goes like, yes, several times. And I like, did the professor hear you scream? No, but like the worst part of it wasn't the procedure. The procedure was fine. The worst part of it was when they put the oxygenated water into you. That's really good for stopping the bleeding and cleaning the wound, right? They use oxygenated water. My God, that is unpleasant. That is not good. You know, that is not good. And that was like really. But then I finish all up. I get dressed very slowly, and they ask me, it's like, you need to change the bandage. Like, do you know how to change a bandage? And I'm looking at it. It's like, yeah, but like the position, you know, it's a little bit difficult. And it's like, well, okay, well, can't your girlfriend do it? Like, she's a doctor, right? And it's like, yeah. And then they mention, it's like, okay, I'm fine, you know, my girlfriend can change it. But then they say, it's like, she's going to have to pour oxygenated water. It's like, no, man, no. Like, I don't want domestic violence in my family. It's like, if you sit on top of me and you pour that shit into my wound, I'm going to act like Rambo, you know, remembering his clips from Vietnam. No. Like, I don't want that. I'm going to come here. Like, he basically wanted me to avoid going back to the hospital, you know, because now there's a lot of COVID patients there. It's a little bit of a waiting time until you can get the doctor to see you. And was like, well, can't you do it at home? You know? Okay, you're both doctors. Can't you do that? No. You're going to come back then. Okay. And then I found out that my uncle is sick with COVID. So there's that. He also has a lot of complications. He's got diabetes. He doesn't have obesity, but like anyway, I'm not going to go through his medical list. So it's really bad. I'm thinking like, why are all of these things coming one after another, man? Like, what is up with 2020? Like literally, all of these things are coming up one after another. I used to have even a pink eye, a couple of weeks earlier, and a couple of other issues, and it's like, why are all just piling up? Like, why can't they separate each other over the course of a longer time? But hey, you know what? I hope your day is doing a lot better than mine. I hope this video managed to entertain you a little bit. Yeah, I'm going to go do This Week is Stupid now, see if I can be cheery and cheerful and sarcastic while I have this phenomenal pain on my back. But hey, you know, comes with the profession. Let me know how you guys feel, and I'll be reading from you guys in the comment section. Take care.